you can protect yourself against bias by asking patients a question. You should have greater reliance on symptoms and ask everybody, what is the worst itch you've had in the last 24 hours? It's a simple question. 0 is nothing. 10's the worst and manageable at any moment in a 24-hour period. And I can't tell you that one thing takes less than 15 seconds, has totally transformed my management of patients. Patients I thought, oh, it's not bad. We can give you a topical steroid. Then I saw their itches over a 7. And anytime your itch is, a 5 or higher, especially a 7 or higher, that means they're not sleeping. That means they have low quality of life. That means they have all of these other metrics that are terrible, more anxiety, depression. Anytime I get a 7, it triggers me to go into talking about, discussing systemic therapies as well. So I can't tell you how many patients that has changed their management. And also it's helped me correct also some type of a visual bias where we may not be appreciating the erythema properly. So we have to know that, especially in skin of color patients, we have to be hypervigilant about asking about objective symptoms, itch, sleep, all these factors, and it makes dramatic differences. Patients who are for years on topical steroids, after I ask that question, immediately go to systemic. So it can have just such a transformative effect from that simple knowledge of realizing you're not going to have the same degree of erythema.
That is such an important and helpful pearl, one that we can all implement in our practices immediately, asking about itch and rating it on a scale.